So welcome everyone to today's talk. We are talking today about the Smart Choice Health Insurance Program and what to do if you've lost your health insurance. Today's talk was developed by myself from the University of Delaware Cooperative Extension, and I'm Maria Pippidis, a failing consumer science educator with University of Delaware Cooperative Extension, and a colleague at the University of Maryland Cooperative Extension. And today's talk is co-sponsored by the Delaware Money School and the Delaware Division of Libraries. So we're going to jump right in and talk about today's goals. So today we're hoping to spend a little time talking about why replacing health insurance is so important. We're going to talk about some resources that are available to you when you've lost your health insurance and how to compare and understand costs and coverage. And then we're hoping to work through this workbook that we have called the My Smart Choice Health Insurance Workbook, which is really going to help you identify information you need in order to comparison shop and make a good choice around health insurance. So our first questions are really why? Why do I need health insurance? And why is it so important? And, you know, it's sort of the first step in understanding how to make a smart choice about health insurance. Quickly, I'm just going to go over these points. Certainly, having health insurance provides a peace of mind, and it can help protect your family's financial future. If you have a broken arm, for example, and you don't have health insurance, it could cost you anywhere between $10,000 and $12,000 for setting the arm, kind of that hospital visit, and the follow-ups, and any prescription drugs you might take in order to manage pain. And so that can make a big dent in your financial resources. So having health insurance can provide that peace of mind and help you offset some of the costs of health related accidents or chronic disease. Certainly there's health and wellness services and programs that you can access. Some of them are offered by the health insurance plan. Some of them may be offered in combination with a health care provider. And so some of those may be free and preventative in nature, and some of them may cost a little bit, but health insurance will cover it. And ultimately, it's about better health outcomes, meaning we know from the research that if you have health insurance and use it, your health outcomes over time will be better. So let's talk a little bit about the what, right? What are the options available to me if I have lost my health insurance, and what do I need to compare or consider in order to make a smart choice? So right now, options that are available really depend on your situation. So if you have had health insurance from an employer, you may be able to sign up for COBRA. And I'm going to talk a little bit more about what each of these are. So one option might be signing up for COBRA. Another might be adding yourself to your spouse's health care coverage. A third option would be to buy a plan from the health insurance marketplace. And the fourth, depending on your income, you may be eligible for Medicaid and or the Child Health Insurance Program, which would cover children under the age of 18. So we'll talk a little bit more about each of these now. So what's COBRA? COBRA is an acronym for the Consolidated Omnibus Reconciliation Act. And it gives workers and their families who've lost their health benefits the right to choose to continue group health plans that had been provided by their employer. So that means that you would talk with your employer about the opportunity to continue your current healthcare plan that you had offered through your employer. And that coverage usually can last up to 18 months. How can you have access to this? It comes from if you have lost your job either voluntarily, meaning you've left, or involuntarily, meaning you've lost your job, or if there's been a reduction in hours or a transition in your job or something that happens in your family. And that would allow you then to have access to that healthcare plan that you're familiar with through your employer. One of the downsides then is your employer, especially if you're not employed with them anymore, doesn't really have to contribute, right, to the paying for that health insurance coverage. And so you may end up paying the entire premium for up to 102% of the cost of the plan, and that extra 2% may be sort of the administrative fees that the health insurance company tacks on, I'll just say. So that's the COBRA. And for some people, that may still be a very affordable choice compared to other options out there. And some of that depends on your income. Okay, what about signing up through my spouse's health insurance plan? Well, obviously, it depends on whether or not you have a spouse or not who has a health insurance program. But if they do, you may be able to be added to your spouse's healthcare plan. And so what would really need to happen is your spouse would have to talk to the Human Resources Department to ask about what kinds of options are available, whether they can be added. And usually sometimes when there is a change in situation, like you've lost your job and lost your health insurance, they would be able to amend your current contract to add that person. Obviously, the cost of that coverage will come out of your spouse's paycheck, and you're going to really want to comparison shop. Now, all of this really depends on whether or not that your spouse's place of employment offers health insurance to spouses or family members. If they don't, well then we're on to the next option. Okay, so what is the health insurance marketplace and how can I kind of find out more about it? So the health insurance marketplace is the marketplace that was created through the Affordable Care Act in 2010. It's otherwise known as Obamacare. In Delaware, the website where you can find out more information about it is choosehealthde.com. And I've got a little picture up there of the actual website. Now in Delaware, there is an open enrollment period that happens in October through the middle of November every year. And that's the opportunity then to look at plans and sign up with coverage starting in January 1st. However, if there is a change of circumstance, people can enroll throughout the year. So a change of circumstance might be that you've lost your job and therefore lost your health insurance. So you have the opportunity then to enroll, I'll just say any time of year, when there's been a change of life circumstance. The caveat is, or the thing to know, is that you have a window of enrollment that's 60 days before and 60 days after that loss of a job or whatever the life event is, right? So you have this 120-day window in which to enroll. After that, you're kind of out of luck and you have to wait until the open enrollment period. So one of the benefits of going through the healthcare marketplace is, depending on your income, you may have access to tax credits and subsidies that will reduce the premium amount. This depends on the income, as I've noted here. And we're going to go through a little example to kind of show how this may work. Before we do that, I just want to reiterate, how do you get connected, right, to the health insurance marketplace? So you can go to choosehealthdelaware.com and there's an online enrollment process, or you can get some help with what we call marketplace assisters. And right now, the West Side Family Healthcare Organization is contracted to do that work. And so I've listed here the 2 phone numbers, the one for Newcastle and then the one for Kent and Sussex. So that would be a place to call and have a conversation with an assister, and they could help you enroll. What could my premium slash deductible be? So this is one of those tools that is on healthcare.gov website, actually, that allows you to see the plans and also helps you better understand what those prices or costs might be. And so you can see from this page, one of the things that you would do is put in your zip code and hit continue, and then it would take you to the information about Delaware's plans. So I made up a situation and thought I would just do that to kind of show a little bit about what the costs and the deductible, the premium may be. And so I put in this story, right? I have an income for this family of $55,000 per year. It's a 3-person family. One's 57, one's 56, and a child of 12. And it crunched the numbers, and it said I would have a total estimated tax credit of almost $2,000. So that's $2,000 per month that would be credited towards the cost of the plans. That's a really large chunk of change. So then the next step in the process is to really look at the plans. And so I pulled up 3. There are actually 8 plans available in Delaware. And I pulled up 3 that kind of had different characteristics, I'll just say. And so up here along the top, you can see these are the names of the plans, right? The shared costs, blue, EPO, gold plan with 2 free doctor visits per year. Then we have the shared cost blue EPO bronze plan, $3,900. And then we have the health savings embedded blue EPO silver, $3,950 HSA plan. Oh gosh, just that alone, I'm sure creates lots of questions, right? So within the health insurance marketplace, they organize the plans by bronze, silver, gold, and platinum, and they're on this continuum. The bronze tend to have lower premiums, but higher deductible costs and co-insurances. And as you move along the continuum, that balance between the premium and other out-of-pocket costs shifts. The premiums become more expensive, but the other out-of-pocket costs get a little less expensive. So what I did here was I picked a bronze, that's the one in the middle, a silver, that's the next one on the continuum, and a gold plan, and just to sort of show the difference, right? And so across that first row then is the estimated monthly premium, and you can see the bronze in the middle has no premium at all, which is really nice. The silver plan, which is the one all the way to the right, that has a premium of $276.55 per month. And gold plan with the 2 free visits is $317.50 a month. And so you can see by what is read in the kind of the gray part of the column or the row there is it has applied a certain amount of that tax credit, right, to reduce the overall cost to you. Now notice the second row that has to do with the deductible. So the deductible, right, is the amount that you have to pay before the health insurance starts to cover healthcare expenses. Now, in the case of the Highmark, the gold plan, the first column, there is no deductible, meaning you can really access care without any additional out-of-pocket costs outside of that $317.50 per month. Plus, you get 2 free doctor visits, right? On the other hand, our other 2 plans have relatively higher deductibles, that $3,900 and $3,950 for the bronze plan and the silver plan. For someone who is relatively healthy, it may not be difficult, right, then to never really have met that $3,900 deductible. So for someone who may be really healthy, the bronze plan may work very nicely, right? Because it's zero premium. And if you don't go to the doctor very often, you may not meet that deductible. But if something out of the ordinary happens, say you break that arm, right, then you know you're going to have that $3,900 to cover the deductible. And from a family perspective, it's $7,800. The silver health savings account plan, which is on the right-hand column, also kind of has a higher deductible, but it also has this health savings account piece embedded, meaning you could be setting aside money tax-free into a health savings account so that when something happens, you have the money to help cover that deductible. But because it's tax-free, right, you're getting a little bit more bang for your buck as you're putting money into that savings account. Some people then ask me, well, what happens at the end of the year with that money that's in the health savings account? Well, you would still have it. It would roll over into next year. And as long as you kept a health savings account type of policy, you can continue to put money aside each year towards your healthcare costs. So for some people, this is a really great investment. And for those people who are closer to retirement, right, that money can stay with you even in retirement, even if you move over to Medicare, right? And as long as it's used for healthcare expenses, it's available to you. So some people look at this as a really good tool to save not only for now, but also for future healthcare costs. The last row has to do with out-of-pocket maximum. So with these plans, a nice change, I'll just say, from plans that we are used to from the past, is that they have an out-of-pocket maximum. And an out-of-pocket maximum means that when you have spent, in the case of the first column, $7,500 for your individual or for $15,000 family total, then the health insurance company will cover all other expenses. Now, that figure does not include the premiums. So it's really everything else. It would include the deductible, co-insurances, co-payments for any services that are allowable. And so I say that because there may be some costs, say it's cosmetic surgery, that would not be covered by insurance. And so therefore, even if you elected to do them, it would not become part of that out-of-pocket maximum. Okay, so that was the marketplace. And so one of the other questions I often get is about the Medicaid and the CHIP program, and how does that work? And so in Delaware, they have connected the application for Medicaid and CHIP to the healthcare marketplace website. So that's why they're kind of connected. But what the heck is Medicaid and CHIP? So Medicaid is subsidized health insurance program for individuals and families, right? You have to meet some sort of income eligibility requirement, and that is based on family size, like who would need to be covered, and your income, and that income level changes depending on your household size. So and then CHIP is what's called the Children's Health Insurance Program, and it covers just children 18 and under. So for some people, for example, they may have a health insurance program through their employer, but their employer plan doesn't cover family members. So depending on your income, right, you might be able to get your health insurance through your employer, but CHIP for your kids. In a limited resource situation, whereas like if you've lost your job, right, you may qualify then for Medicaid for yourself and CHIP for your children. So there's two ways to kind of find out whether or not you're eligible, and one is actually going through the health insurance marketplace, and you put in information about your zip code and your number of people in your family and what your income is, and then it kind of helps you to see whether or not you're qualified. And then the next step would be, you know, to connect in with the Medicaid agency and move an application through. So this clip I actually pulled from the healthcare.gov website, and you can see down at the bottom, you really start out with what state are you in. So for the family that I made up, my family of 2 adults and 1 kid, I kind of tried to calculate out, well, at what point might they be eligible for Medicaid, and it turns out for an income of about $30,000 per year in 2020 in Delaware, that family would be eligible for Medicaid. So it's low, but it's not terribly low. In Delaware, we have expanded Medicaid, meaning it's not just at the 100% of the poverty level. It's 128% of the poverty level. I believe that's the number. So in Delaware, we've expanded Medicaid. Other states have not. Okay, so what are some things to consider, right? Certainly you want to understand the costs. What's the premium, the deductible, the out-of-pocket maximum, those co-payments and co-insurance. As Janet said, all of those are going to add up. It's not just about the premium and whether or not you have money set aside for the deductible. It's how do I use health insurance, healthcare services, and how do those co-payments and co-insurances kind of add up over the year, over and above the premium. So that's the first thing. The second thing is really understanding preventative services. Every health insurance plan now under the Affordable Care Act allows for some preventive care services. And so like your annual wellness check, for example, you may not have to pay for either with a copay, for example. So understanding what those preventative services are, and the only way you're going to know that is to look into that explanation of benefits document or online through the health insurance provider to see kind of those nitty-gritty details of what the plan covers. You want to understand the type of plan, and because it impacts kind of how you access care, you know, whether you have to go get a referral, whether you can go out of network, and if the plan covers some of that or not, right? All of those things are important in terms of figuring out, well, which type of plan do I want to pick? You want to understand the time frames for applying for benefits, right? Either through your employer or through your health insurance, through the health insurance marketplace. Most of them have, you know, kind of like life event changes, the option to sort of reassess and reconnect in to change your plans or access a plan. And then lastly, understand your needs and the costs based on those needs. And so one of the things I wanted to very quickly go through is one of the documents that I sent you, and that was called the My Smart Choice Health Insurance Workbook. Okay, so we're going to do a quick overview of that workbook. And that workbook is like 24 pages long, so you might not want to print out the whole thing, but there are parts of it that have places where you can write. So this is the front page of the workbook. It really helps you think about what are my needs and how do I estimate them. So one of the first steps is really understanding how you use healthcare. And so you can see it's a place where you can begin to inventory, right? who's in your family, which doctors do they see, how often do they see them, because that's really going to impact that question of copays, right? So that's one of the first worksheets that you want to fill out. Then the next bunch of worksheets is a tool that you can use to comparison shop between 3 health insurance options. So you can see in the first blue column all the way to the left, it's the kind of the type of thing, a criterion or aspect of a plan. And then in columns 2, 3, and 4 is a place where you can begin to comparison shop and sort of mark off the information about those plans. And so you see, what kind of plan is it? What kind of, if it's a, what level or what type, where is it coming from, right? Is there co-insurance for certain services? Are all of my doctors and specialists part of that network? And so that may take a little digging to kind of say, oh, well, here's this plan. And yes, my doctor's in there, or no, my doctor's not. Can I choose my healthcare providers? That would be another question. But there's like 3 pages of this piece that helps you kind of like sort through the information about the plans. The other thing that's kind of neat about this is on the right-hand side are important words to know. And so right there is definitions of keywords that may be helpful to you as you're sorting through. When you kind of get to the end of the worksheet, it actually gets you to calculate out based on the number of times you see different kinds of doctors and doctors or specialists and the co-payments associated with those plans. It actually gets you to crunch the numbers. So by the end of it, you'll be able to see, well, this plan, right? The premium plus the co-payments plus any deductible is going to cost me this much versus plan B, which may be a little bit different, versus plan C, which may be a little different. And at the end, then you can almost figure out, there's a tool in there that gets you to think about, well, how does this impact me monthly, right? If I was not only paying the premium, but setting aside money each month to build it into my monthly plan, how much would that cost me? So there's a tool in there that helps you do that. And then the last tool is this monthly spending plan. And so this is a place where you can begin to look at not only what my healthcare costs are, but how do I fit that into my monthly spending plan? And maybe what do I need to adjust in order to get the health and care costs that I may need, right? So questions that you need to answer, we did answer, right? Why do I need health insurance? Why is it important? What are health insurance options out there? What do I need to consider? And hopefully we've covered enough of that so you can really make a smart choice. I've included here some resources, some of which are in some of the materials that I've sent you. The University of Maryland Health Insurance website has really all of the resources that they and I have worked together to develop. Healthcare.gov is sort of the big website that the Center for Medicare and Medicaid put out there. And I have to say, it's a really great website. It's written in a layperson's terms. You can navigate it pretty well. There is a healthcare.com website that is a place where a company is selling insurance. You don't want that one. You want healthcare.gov, right? The Delaware Health Insurance Marketplace is at choosehealthde.com. You can also get to it through that healthcare.gov once you kind of put in your zip code. I included an IRS website here because this is the publication that deals with kind of understanding how the IRS looks at medical expenses and has information about those health savings accounts and flexible spending accounts and what kind of health care costs might be deductible and all those kinds of things. And then that marketplace calculator to kind of figure out, would my premium be subsidized, is this last URL right here, healthcare.gov, see plans.